Firstly, eye position is checked. This patient's eyes are rotated ventrally, which indicates that they are in a good surgical plane of anaesthesia. We then check for the presence of a palpebral reflex. A palpebral reflex becomes slow, and when tapped there is either little to no response when under a surgical plane of anaesthesia. As you can see for this patient, there is little to no palpebral reflex, which means they are in a good plane of surgical anaesthesia, but as there is no response at all, it's important to be aware that we don't want the anaesthetic depth to increase further beyond this. In checking jaw tone, we want to make sure that it loosens, offering only a light resistance when pulled, allowing staff to easily maneuver it for intubation and throughout the surgery. Cats will require a local anaesthetic throat spray before intubation, but as we can see, this patient has already been intubated and their jaw tone is nice and loose. The heart rate of the patient is then checked. It is normal for the heart rate to drop under an anaesthetic. This should be monitored carefully, as continual slowing can be dangerous, and increasing can indicate the patient is not fully anaesthetised to the level required. This is important as a result to TPR the patient beforehand to make sure that we know their ordinary heart rate prior to surgery, which provides us with a baseline on which to judge whether their heart has significantly increased or slowed. This patient's heart rate is nice and even and hasn't dropped significantly beyond his regular resting heart rate. Breathing rates are monitored, as a decrease can signify the patient is too deeply under, and an increase once again indicating that the anaesthesia is too light. This is also why it is important to record the animal's regular respiratory rate, as with the heart rate, in order to have a point of reference for increases and decreases. We also look at the oxygen saturation levels, which indicates the concentration of different gases coming in and out of the patient. It is important for the oxygen to remain high to ensure adequate oxygen is travelling to the organs during the procedure from the blood. This patient's breathing is strong and regular, and he's taking regular breaths and demonstrating a good solid effort when doing so. The animal is then checked for the presence of a withdrawal reflex. This is a spinal reflex, which is in reaction to what the body believes to be threatening stimulus, basically. So by pulling firmly and pressing tightly between the animal's toes, a reflex retraction of the leg will occur if the anaesthesia is probably too light. As such, this patient isn't demonstrating that he's too light at all. If anything, he is in a very good surgical plane of anaesthesia that we wouldn't want to get any deeper.